Hi, I am Dr. Saqib Mansoor from my channel Learning Anatomy, and today I will discuss with you anatomy of the ulnar bone. Yes, there are two bones present in the forearm, the radius and the ulna. Previously, I discussed with you the anatomy of the radius, and today I will discussing with you the anatomy of the ulna. Right? This is the ulnar bone. Right? This is the thing. This is an ulna. This is anterior view, and this is the posterior view of ulna. And we'll discuss all the details subsequently and with a great elaboration. So just to recapitulate, this is the humerus, and this is the radius on the lateral side, the ulna on the medial side of the forearm, and this is the joint, the elbow joint, right? And this is the extension of the forearm at elbow joint, and this is the flexion. This is an overall view of the bones of the forearm, of the upper limb, and all these have been discussed. This is the last of the topic to be discussed by me today. This is the anatomy of the ulna. That was the anterior view. This is the posterior view. Yes, and again, this is the thing. This is the articulations, how they make the joints with each other. That I will discuss later, right? Ulna. Ulna gets tapered in the reverse way to radius. It is large at its upper end and small at the distal extremity, where head is lying. The head of the radius is at its upper end. Here you could see this is the, it is large at the upper end, the ulna, right? It tapers as it goes down, then, right? And it is the reverse in the case of the radius, which gets broadened as it gets down, goes distally. So let's talk about the upper end of the ulna. It spares two projections having a saddle-shaped articular surface between these two. This is the saddle-shaped articular surface known as the trochlear notch. These are the olecranon and the coronoid process. The two projections are the olecranon process. You follow the laser, and this is the coronoid process. And they serve to grip the trochlear surface of the humerus. The olecranon, this is the proximal extension of the shaft as I shown. Yes, here I showed you. Here, this is olecranon, proximal extension of the shaft located posteriorly. It is subcutaneous and can be easily palpated. When elbow is extended, it is placed in the olecranon fossa of the humerus. It is bent forwards and possesses an upper surface that gets the tendon of the triceps over a wide area. It has an anterior border that forms the sharp, wavy lip at the articular margin. Capsule of the lip joint gets attached just behind that lip. Here you could see this, right? This is the olecranon process. This is the upper or the superior surface here. Here you could see the muscle, the attachment of the triceps brachiae. This is the triceps brachiae. You follow the laser, getting attached here. It can zoom in for you. You could see clearly. This is the triceps brachiae muscle. Triangular posterior surface of the ulna is subcutaneous, where the olecranon bursa lies on it. Sides of the triangle continue below the apex into sinuous subcutaneous border of the shaft. They provide attachment to the deep fascia of the forearm, subcutaneous border. Here you could see this is olecranon, this is the posterior aspect, and this is the subcutaneous posterior border of the ulna. Flexor digitorum profundus takes origin from the medial surface of the olecranon. At upper angle of this area, the posterior band of ulnar collateral ligament of the elbow gets attached, and the anconeus gets inserted on the lateral surface of the olecranon. These are the two muscles, right? This is the flexor digitorum profundus. Let me enlarge for you. This is the flexor digitorum profundus. Here you could see this. This is the flexor digitorum profundus going up. And this is the attachment of the anconeus. This is here. This is the origin, and this is the insertion. Ulna continues. Coronoid process projects anteriorly from the upper end of the shaft. It has a thin anterior lip and abuts on articular margin. Medially, this lip has a conspicuous smooth elevation, which is called as the sublime tubercle. You could see the sublime tubercle, right? This is the olecranon. This is the coronoid process, right? This is the trochlear notch, and here you could see this tubercle. This is the sublime tubercle marked over here with its asterisk. You see the laser. This is the sublime tubercle. Flexor digitorum superficialis is attached here and deep to this ulnar collateral ligament of the elbow. Ulnar nerve is lying in contact with the ligament. Distal to the sublime tubercle, deep head of the pronator teres gets attached to the medial border of the coronoid process. Here you see flexor digitorum superficialis being attached here. Flexor digitorum superficialis. We can enlarge that so for clarity. You see flexor digitorum superficialis. Here you see. This is you can see also here the pronator teres muscle attached. Concave anterior surface of the coronoid process gets insertion of the brachialis, right? Show you already the brachialis muscle attachment. I will show you. This is the, go back, the brachialis tubercle. This is the brachialis tubercle. And let's see the brachialis muscle. This is the brachialis muscle. This is being attached over here. This is the brachialis muscle. The rough lower part of the anterior surface forming the ulnar tuberosity. Let's also see the ulnar tuberosity. This is the tuberosity of the ulnar tuberosity. Lateral surface of coronoid process bears a concave facet, the radial notch, to accommodate the head of the radius. This surface is covered with hyaline cartilage that is continuous with that of the trochlear surface. You see the radial notch. Here you could see this is the radial notch. It's covered with hyaline cartilage, continuous with this olecranon. With this is the trochlear notch, hyaline cartilage. Anterior and posterior margin of the notch, this notch, radial notch, provide attachment to the annular ligament, and the quadrate ligament gets attachment to the shaft immediately below the notch. Just below this, the oblique cord gets attached. So again, the ulna continues, lying between the projections of the olecranon and the coronoid process is situated a deep saddle-shaped surface called the trochlear notch. This is some detail of the trochlear notch. This is a deep saddle-shaped surface. This is the notch, the trochlear notch. It is convex from side to side. You could see from side to side, it is convex. And it's concave from top to bottom. From top to bottom, it is concave. You could see. And fits the trochlea of humerus. The trochlea of the humerus, I've discussed humerus already. It's on YouTube, you can see there. And it fits in this notch to make the elbow joint. Long radius is also involved in that articulation. It is convex from side, right? Notch is covered with the hyaline cartilage, which is at times constructed in an hourglass manner or even gets separated into two surfaces, one on olecranon and one on coronoid processes. Right? It can be constructed in the middle in an hourglass manner. Capsule of elbow joint gets attached around margins of the trochlear notch. These are the trochlear notch margins, and the capsule of the elbow joint attached here. And the in this manner, the elbow and proximal radio-ulnar joints constitute one cavity. Now, the words about shaft of the ulna. Shaft is angled a bit laterally from the line of trochlear notch to constitute the carrying angle. Here you could see this is the ulna, and this is its shaft. It is curved. You have see laterally here, right? And it forms a carrying angle, very important in carrying weight. It keeps the thing away from the body. From posterior margin of the radial notch, a vertical ridge travels distally. It is called the supinator crest. Let's see the supinator crest. This is the supinator muscle attached to the supinator crest over here. This is the supinator muscle. This is the supinator crest. You see, this is the supinator crest, the attachment of the supinator muscle. Here is the supinator ridge. Your supinator muscle attached to that supinator crest. Supinator, the supinator, again, I mentioned supinator arises from this crest, supinator crest and concave area in front of it. At the middle of the shaft, a conspicuous ridge, the interosseous border, projects laterally. Interosseous membrane gets attached here. This is the interosseous membrane. You see the laser, this. And this is the interosseous border of the interosseous membrane is attached of the ulna, interosseous border of the ulna. Narrow extensor surface, talking about the extensor surface of the shaft, is lying between the interosseous border and subcutaneous posterior border. Here you could see. This is the posterior aspect, and here you can see this is just showing the extensor surface. Broad flexor surface extends around medial side to the same subcutaneous border. Flexor digitorum profundus takes origin from flexor surface. Here you could see this. This is the anterior view, and this is the flexor surface. This is the broad flexor surface. And the extensor surface of the ulna is not broad, it is relatively narrow. Here you could see this is the flexor digitorum profundus attached to that flexor digitorum profundus. Let me zoom in for you. Here you could see this. This is flexor digitorum profundus, and this is attached here to this ulna. This is ulna. Pronator quadratus takes origin from a ridge on flexor aspect of the lower part of the shaft. Here you could see, I have to enlarge it. Here I must have to enlarge that. Here you could see this. This is the pronator quadratus. Here, this is the pronator quadratus attachment. You identify the bone. This is the radius laterally, and this is the ulna medially. And medially is the origin of the, red color is the origin. So pronator quadratus muscle takes origin from it. Subcutaneous border gets attachment of an aponeurosis, which is common to the flexor digitorum profundus, flexor carpi ulnaris, and the extensor carpi ulnaris. Abductor pollicis longus, extensor pollicis longus, and extensor indicis arise from the extensor surface in their order from proximal to distal. So you see, this is the, first of all, the flexor surface. And here you could see various muscles in their order, flexor digitorum profundus here. This is a flexor carpi ulnaris. This is extensor carpi ulnaris. And here you could see three more muscles in extensor surface, extensor pollicis longus, extensor indicis, and this is the abductor pollicis longus muscle, right? Let me enlarge for you this. I think that will be a beautiful view of the muscles in zoom view. Here you could see this is flexor digitorum profundus annula. This is flexor carpi ulnaris muscle, the ulnar origin. Here you could see. And this is extensor carpi ulnaris muscle, ulnar origin, right? And now the extensor surfaces. This is the, first of all, you see from here, the above is the abductor pollicis longus. Here you could see abductor pollicis longus. Below is the extensor pollicis longus, and still below is the extensor indicis. These are the 6 muscles. So lower end, the lower end of the ulna is expanded into a small rounded prominence called the head of the ulna. So interesting to note that head of the ulna is lying distally, and the head of the radius is lying proximally. Here you identify and see that this is the head of the ulna in ulnar notch of the radius, and you see this is the ulna tapering down below, and this is the head of the ulna. Still down, you can see that this is the head of the ulna. This projection, this is the head of the ulna. Its radial and distal surfaces of the, this is talking about the head of the ulna, I'm talking about to you. Its radial and distal surfaces are covered with the hyaline cartilage to articulate with the ulnar notch of the radius and the articular discs of the wrist joint. Here you could see this is hyaline cartilage covering blue in blue, covering this head, and this articulates with the articular disc, and it also with the distal radioulnar joint with the this radial distal end. This triangular fibrocartilage gets attached by its apex to the base of the styloid process, which projects distally from medial margin of the lower end. This styloid process is smaller than radial styloid process, which extends approximately 1 centimeter more distally. Of course, I told you already in my discussion with the video on the radius that this relationship bears a clinical importance. And you again see the styloid process of the ulna. It is lying more proximally, and this is styloid process of the radius lying distally, right? So clinical importance in fractures of the bones. A groove along this process on its extensor surface houses the tendon of the extensor carpi ulnaris. Here you could see this is the extensor surface, and this groove would be here for the passing of the this muscle extensor carpi ulnaris. Here you see the laser. Also, here you could see this would be the ulna head and groove for the extensor carpi ulnaris. Here, this is the groove. This is a cross section, the middle of the shaft of the 2 bones. This is ulna. This is the medial surface, and this is the anterior surface, and this is the posterior surface. These are the 3 surfaces, and the borders. This is the posterior border. This is the interior border, right? And this is the interosseous border. And this is the interosseous membrane attached to the interosseous borders of the ulna, and they're extending to the radius, interosseous border of the radius. This is also a cross section, and here you could see this is radius, this is ulna, this is the anterior compartment of the forearm, this is the posterior compartment of the forearm, and this is a deep fascia, right? So, and this is the interosseous membrane. Here you could see this is a lateral intermuscular septum. In the last, I will talk about the ossification. Ulna starts to ossify in cartilage at the 8th week of intrauterine life. There is a secondary center for head, the growing end. So lower end is the growing end, which fuses with the shaft at approximately 18 years. 2 secondary centers take part in the development of olecranon. They fuse with the shaft at about 16 years. Thank you very much. With this, I complete my discussion of the bones of the upper limb, and now I plan to do the all bones of the lower limb. So stay tuned, press the bell icon, and subscribe my channel. Thank you very much for watching my video, and goodbye.